Hi, I am Dr. Shoeb Khan, consultant nephrologist, transplant physician, Medicare Hospital, High Tech City. Friends, kidney disease is not so uncommon. Actually, it's very common. Just that people don't know that this thing is with them. So, in general, I would like to today talk about the diet. Diet has many intricacies to it, which any dietitian or there are so many nutritionists who can tell you each details about it. In this video, I would like to just summarize and give you the basic principles through which you can build up your building. Today, we'll establish the foundation of diet. So in general, we have the normal population who does not have a kidney disease, or probably they don't know they have a kidney disease. So for these guys, I recommend everyone to take at least 2.5 to 3 liters of water per day. Second, to have a diet which is rich in fruits and vegetables. And this sort of a diet is called a DASH diet, which is supposed to be the best diet. Don't go for all those LCHF, keto, so many diets are there. But DASH diet is something which is the best, which I'll make another video on that. Second is we have a population called who has an acute kidney injury. This disease is temporary. They may have a high creatinine, they may even need dialysis, but it is not permanent. It's just an AKI, acute kidney injury. These patients need to have a high protein intake because this is a catabolic state. Muscles are breaking down, body is breaking down. They need to have a high protein diet to replenish the nutrition. Second is water intake depends on the urine output. If there is no urine or very less urine, you need to take less water. And if there is a lot of urine output, take more water. And salt intake should be less, roughly around 3 grams per day. Now comes a population called chronic kidney disease, CKD. These people have a permanent sort of a kidney disease. To treat CKD is not very difficult. It's about delaying the progression of CKD. And progression happens if you take a high protein diet. So all patients who have a chronic kidney disease, I request them to have a low protein diet, roughly around 0.7 to 0.8 grams per kg body weight, and a low potassium diet, because if you take a high potassium, lot of fruits, then the potassium can go up and cause problems to your heart. So the potassium should be around 40 to 60 milliequivalents per day. And the third thing is a low salt diet. If you take a lot of salt, that will cause high blood pressure, that will cause swelling in the body and eventually worsening of the kidney function. So roughly around 2.5 to 3 grams of salt per day should be the salt intake for all patients who have a CKD. The calorie intake should be around 30 kilocalorie per kg per day. Now, these patients, they end up on dialysis. And then if you are on dialysis, then again the diet is, you need to have very high protein diet. It's a stressful process. Blood goes out through the machine, gets filtered, comes back. Then it's a catabolic state to some extent. So you should take roughly around 1 to 1.5 gram of protein per day. And there is no dietary restriction, except that you need to take a low potassium diet, less water intake, and third thing is low salt. Remaining everything you can take. There is no issues because you are already on dialysis. And once this dialysis patient gets a transplant done, then again the diet changes. Here the creatinine is 1.0. There is absolutely no diet restriction. You can eat anything you want, whatever you want, but make sure that the water intake is high, roughly around 3 to 4 liters per day, and have a little bit low salt intake and a little bit low protein intake for a long graft kidney survival. Thank you.